When you look at the encouraging news from AstraZeneca and Oxford, there are many questions about, the number of freezing, whether the 90% is different to the 70%, depending on what kind of dose you give. Overall, are we just in a much, much, much better place than we were 3 weeks ago?
We're in a much, much better place than we were 3 weeks ago because we have evidence released that gives us hope that we have 3 vaccines against this terrible illness. Now the process is for that data to be shared publicly, for the regulatory authorities to look at it in the United States. There will be independent reviewers coming in, independent advisors who will help the agency sort through it. And I think each step will give us hopefully more confidence in the results so that we'll see much higher levels of confidence in vaccination by the time the vaccine doses are rolling out.
Joshua, the elephant in the room was a president of the United States who's playing golf. He gave lip service to the G20. I understand he's lame duck, etc. Okay, we're going to get that behind us. Day one, what does the vaccine team have to do for President Biden? What's the first to do they have to do to get us in gear?
I understand why you're asking that question, but it's a hard one right now because before he takes office, we're going to understand the regulatory status, whether these data hold up. So obviously what happens on day one is going to depend a lot on that. By day one, we're going to know whether we have control over this completely out of control outbreak right now in the United States. And whether we have it under control is going to matter a lot for day one. Actually, I think right now the new team has to be quite flexible because we have 2 months and a lot can happen in 2 months. So I really can't answer the question.
So, Joshua, what are the questions that you would be asking of these vaccines? We're in a much better place than we were 3-4 weeks ago. There's still many unanswered questions. How many people want to get vaccinated? Whether once you get the vaccine, you spread the disease. What's the number, 1 or 2 things that you want to find out?
Well, I mean, the core is how effective are these vaccines and how safe are they? And I think that, it's great to hear from the companies, the top line results, but there are a lot of other results and data that have to be shared. We want to know how well the vaccine works in different populations, particularly in older people. We want to understand the safety profile so people can really expect the side effects, the modest side effects that might happen. And we want to understand, the key elements of how to keep the vaccine active during the transport cycle so people can really plan for major vaccination campaigns. There's a lot that has to happen. And, in the United States, I'm particularly concerned that the states and localities have not gotten any extra funding to help with the largest vaccine delivery project that we've ever had. And recently, they've been submitting plans which assume that they're going to get funding. It is just well past time for Congress and the president to provide funding to states. This is another thing that has to happen in the next couple months. It's too late, in my opinion, to wait for inauguration.
Okay, how quickly can we reach full herd immunity? What are the numbers that we need to obtain across specific countries to make sure that it's safe?
So what we want to see is, the community transmissions declining over time. So that's why, certainly now, because we're having this huge outbreak, but even into vaccination, people still need to maintain distance and wear masks. As the number of people getting vaccinated and are protected rises, then we'll see even greater falls in community transmission. And then we're going to have to, really get a sense for how many people have to be vaccinated in order to keep that number really low. And of course, that'll intersect for a period with the strength of the public health system. So it won't be one place, I think one number, it's this percentage, right at the beginning. I think we're not going to know. And it's going to depend on vigilance and a good public health response. Over time, we'll see, how high it is. And I think depending on the models, people are thinking it's somewhere in the 70 to 80%, but you don't really know until you've done
it. Joshua, given what we know, and I know, we're waiting peer review and things like that, but is it clear that MODERNA, PFIZER have a stronger vaccine than AstraZeneca, or is that still in play?
Yeah, I think I would prefer to hear from people who are independent, can look at the data themselves. That's what the FDA does. And give the best sense of it. So I'm withholding judgment myself until I hear from them.